Hi friends, welcome back to my channel Mukambika Nursing. Friends, here we can see questions for ESIC exam preparation. Also these questions will helpful for your RRB exam, Navodaya Vidyalaya exam preparation and DME Kerala PSC exam. We can see the questions. First question, which type of immunity is affected by HIV infection? Options: option A natural immunity, option B active immunity, option C cellular immunity, option D humoral immunity. Our question is, in HIV infection, which immunity system is affected? And the correct answer is, it is cellular immunity. Option C is the correct answer. Immunity means it's the natural phenomena, is the ability of human body to protect itself from pathogenic organism. Okay, it is a natural phenomena. Here in HIV infection, it destroys CD4 helper T cells. Okay, they are T lymphocytes. T lymphocytes are produced by thymus and they are involved in the formation of cellular or cell mediated immunity. So HIV infection affects cellular immunity. Move on to the next question. When the body is able to make its own antibodies by having disease and recovery or by vaccination is known as. Options: option A acquired immunity, option B passive immunity, option C active immunity, option D none of this. Our question is, body is able to make its own antibodies either by disease and recovery. If any particular disease occurs, from that patient is acquiring own antibodies, or by vaccination is known as acquired immunity. Option A is the correct answer. And the next question, how many months baby use only mother's immunity? Options: option A 3 months, option B 1 month, option C 6 months, option D 12 months. Question is, how many months the baby after delivery the baby can use only mother's immunity? Okay, and the correct answer is first 3 months. Option A is the correct answer. First 3 months of life, the infants can use natural passive immunity. Natural passive immunity means the immunity which transfer from mother bodies to the fetus. Okay, that can use the infant or the baby by first 3 months. Then after that, the baby start to form own antibodies. Another important point from this area is the immunity which get from mothers to fetus or mothers to infant is passive immunity. Passive immunity or natural passive immunity. Okay, that is also important question. From mother's breast milk to the baby or from mother to baby is natural passive immunity or passive immunity. And the next question, therapeutic level of serum lithium is. Options: option A 0.25 to 0.5 milliequivalent per liter, option B 0.6 to 1.2 milliequivalent per liter, and option C 1.5 to 2.5 milliequivalent per liter, and option D 2 to 3 milliequivalent per liter. Question, therapeutic level of serum or blood lithium level, and the correct answer is, it is 0.6 to 1.2 milliequivalent per liter. Option B. Lithium is a mood stabilizer or it is used for the treatment of mood disorders. Okay, here we can see blood lithium level. Therapeutic level is 0.6 to 1.2 milliequivalent per liter and prophylactic blood lithium level is 0.6 to 1 milliequivalent per liter and toxic lithium level is greater than 2 milliequivalent per liter. Toxic serum lithium level, we can see lithium toxicity symptoms begin when the serum lithium level is 1.5 to 2 milliequivalent per liter. Okay, so the toxic symptoms begins when it is the lithium serum lithium level will goes 2 milliequivalent per liter. Mild toxicity means it is 1.5 to 1.5 milliequivalent per liter, and moderate toxicity means between 1.5 to 2.5 milliequivalent per liter, and severe toxicity means greater than 2.5 milliequivalent per liter. Okay, mild toxicity, moderate toxicity, and severe toxicity. Okay, move on to the next question. Extrapyramidal symptoms are associated with options. Option A anxiolytic, option B antipsychotic, option C antidepressants, option D anti-manic. Extrapyramidal symptoms are the features of antipsychotic. Option B is the correct answer. Here we can see the side effect of antipsychotic medication. First we can see anticholinergic effect. Anticholinergic effect means antipsychotics which block the activity of acetylcholine. Okay, so that some effect will or side effect will occurs in the body. They are dry mouth, increased heart rate, urinary retention, constipation, and hypotension. Okay, these are the anticholinergic effect: dry mouth, increased heart rate, urinary retention, constipation, hypotension. Okay, and extrapyramidal side effect include Parkinsonism, dystonias, akathisia, tardive dyskinesia. These all extrapyramidal side effect. And other side effects include drowsiness, blood dyskaryosis, pruritus, photosensitivity, elevated blood glucose level, increased weight, impaired body temperature regulation, and also lactation gynecomastia. These all other some side effect associated with antipsychotic medication. And the next question, lithium therapy during pregnancy increases the chance of dash in fetus. Options: option A neural tube defect, option B defect in extremities, option C cardiac malformations, option D anencephaly. Question is lithium therapy during pregnancy. A pregnant woman is taking lithium means how it will affect the fetus. Okay, that is the question, and it can cause cardiac malformation. Option C is the correct answer over here. Move on to the next question. What is the priority nursing action when caring for a client with disseminated intravascular coagulation? Options: option A monitor for Hoffman's sign, option B avoid giving intramuscular injections, option C take temperature via the rectal route, option D apply sequential compression stocking. Here the question is, what is the priority nursing action or primary nursing action for a client with DIC? DIC means disseminated intravascular coagulation. In DIC, there is a rapid and extensive formation of blood clot in microcirculation, which causes platelet and clotting factor depletion in the patient body. This causes bleeding and also potential vascular occlusion of organs. So we have to avoid giving intramuscular injection in order to prevent the bleeding tendencies. Option B is the correct answer. First option, monitor for Hoffman's sign. This is one of the features of thrombophlebitis. And option C, take temperature via rectal route. This can cause potential injury and bleeding but not associated with DIC. And last option, apply sequential compression stocking. This is mainly used to prevent thrombophlebitis. Here the correct answer is option B, avoid giving intramuscular injections. Move on to the next question. A client is admitted with higher than expected red blood cells, that is RBC. What physiological alteration does the nurse expect will result from these clinical findings? Options: option A, increase serum pH, option B, decrease hematocrit, option C, increase blood viscosity, option D, decrease immune response. Here the question is, a client is or a patient is admitted in a hospital with higher RBC, that is RBC count is higher than normal. Okay, so here What is the physiological alteration can occur for the patient? The normal RBC count we can see for male it is 4.5 to 6.2 million per milliliter, and for female it is 4.5 to 5 million per milliliter. Okay, here patient is admitted with higher RBC count. The physiological changes occurs in this patient is increased blood viscosity. Option C is the correct answer. So once the RBC count is increases, the blood flow or the blood viscosity, the resistance to flow the blood will increases in the patient body. Move on to the next question. A client is diagnosed with Hodgkin's disease. Which lymph node does the nurse expect to affect first? Options. Option A cervical, option B axillary, option C inguinal, option D mediastinal. Here question is patient with Hodgkin's disease. Hodgkin's disease is the malignancy of lymph node. Okay. So here the lymph node. Which lymph node is affected first? That is the question. So correct answer is cervical lymph node. Option A is the correct answer. Move on to the next question, and also this is the last question. Which findings is persistent with pernicious anemia? Options. Option A rice water stool, option B hypochromic RBC, option C beefy red tongue, and option D all of this. The question is which is the or which findings is we can see in case of pernicious anemia, and the correct answer is beefy red tongue or red beefy tongue is one of the manifestation of pernicious anemia. Option C is the correct answer. Pernicious anemia occurs due to the deficiency of vitamin B12 or cyanocobalamin. The daily requirement of this vitamin B12 for adult is 1 microgram. For infants, it is 0.2 microgram. This is one of the important point. This is the daily requirement of vitamin B12. Here we discuss previous year questions for ESIC exam preparation. Surely these questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my questions to your friend circle.